New guidelines say women aged 40 and older are now recommended to get breast cancer screening at least every other year. Turning to your health, Brooke is sitting down with a surgical oncologist to break down these new guidelines.
Yeah, joining me today for 5 on 2 is Premier Health breast surgical oncologist, Dr. Celine Samuel. Thank you so much for joining us tonight.
Thank you for having me. It's a pleasure.
Doctor, yeah, absolutely. Let's start with these new guidelines. The U.S. Preventive Task Force is recommending these screenings now every other year starting at 40 years old. It was 50, but there seems to be some confusion for the average woman who doesn't know when they should start this testing. Why the change?
So the guidelines certainly are an improvement in the proper direction, but not sufficient. And I think they've realized that women starting at the age of 50 is just way too late, leading to later diagnosis for patients and missing out on the opportunity for early treatment due to the opportunity for early detection of their breast cancer.
Well, the National Cancer Institute is also reporting on average a 2% increase in women in this 40 to 50 age group. So why is that happening? And then why is it so important now to pay attention to these guidelines then?
So traditionally, the guidelines were always starting at the age of 40 and then women performing their screening mammography annually. And these are the guidelines that organizations such as the American College of Radiologists, the American Society of Breast Surgeons, as well as the OBGYN American College also follows. And then that recently got changed to 50 every other 2 years. And we realized that there was that age group where we were missing out on the early detection, therefore leading to that rise. Let's not forget that the pandemic itself also played a part because we halted elective procedures, but we also halted screenings across the board. And now we've seen that peak in the rise of detection of cancers, particularly breast cancers. And I think that has led them to making that adjustment to the age of 40 rather than waiting until the age of 50 as previously recommended.
So now they've moved it to the age of 40 and it's every other year. Is this applying to all women that are 40, or how do we know our particular risk based on our individual self?
So the age of 40 is for the average woman. And then we have another age of patients that are considered high risk for breast cancer. And really the way that a woman would determine if she was at high risk for breast cancer is to sit down and have a conversation with the breast specialist or her OBGYN. High risk patients are those patients who have a strong family history of breast and or ovarian cancer, patients who have genetic mutations who increase their risk for breast cancer. And then there are also a group of patients who've had chest wall radiation before the age of 30, secondary to having different types of cancers such as non-Hodgkin's lymphomas. And so these are the patients who are considered high risk and rather should be getting a mammogram alternated with a breast MRI every 6 months so that, God forbid, if something does happen, it is caught at an early instance.
All right, we want this to be clear for all of our viewers out there. So at 40 years old and also meeting with a doctor to find out what risk level you might be at. Premier Health breast surgical oncologist Dr. Celine Samuel, thank you so much for joining us tonight.
My pleasure. Thank you.